prayer. First year sequence. Principal Dr. H.M. Harikasar, Secretary Dr. Soumyaman. I would like to start our guest lecture series with welcoming all our guests and chief guests. I would like to introduce about Dr. Kiran sir, today's our guest lecture. We are delighted to welcome Dr. Kiran Bandri sir, a distinguished interventional cardiologist, as our chief guest speaker today. Dr. Kiran hails from Kudligi and began his educational journey at Jnana Bharati School. We are proud to say he is our alumnus of Jnana Bharati School. He completed his MBBS from BIMS, Ballari, followed by MD in General Medicine from Topiwala National Medical College, Mumbai. And later, Sir pursued DM in Cardiology from prestigious Jayadeva Institute of Cardiovascular Sciences, Bengaluru. In his professional career, Dr. Kiran has served as an associate consultant at Apollo Hospital, Sheshadipuram, Bengaluru, and also contributed his expertise to the Gadak Institute of Medical Sciences. With extensive experience in interventional cardiology, Sir has performed an impressive 3,300 angiogram, 500 angioplasty, and 30 pacemaker implantation. He is now bringing his excellence in cardiac care to the community as a founder of Chanakya Hospital. We are privileged to have you, sir, with us today. To share his insight, sir has experience in the field of cardiovascular medicine. He is joining us with the guest lecture series of approach to chest pain and management of acute myocardial infarctions. We are here to welcome you heartily, sir.
Good morning, sir. Yes, sir.
Without further delay, let's start discussion about the topic. Today's topic is approach to chest pain and management of acute MI. In between, I will be using local language Kannada. Hope you understand.
Sir.
Approach to chest pain is when you see a patient or when you see a person with chest pain, how you should approach. What are the thought process you should have, and what are the diagnosis you should have, and how to manage is the discussion. You may think it is little higher level to first year BMS or second year BMS, but you will learn many things what is required. So, as you know, there are branches of BMS, branches of MBBS, there are branches of cardiology as well. Ischemic heart disease, valvular heart disease, electrophysiology, congenital heart disease, heart failure. So, we discuss in two steps. First is approach to chest pain. Little theory about chest pain, then management of coronary artery disease and ischemic heart disease. How the evolution of management came since last 50-70 years, and how do we manage currently, and how to manage in future. So, we will be discussing about this. So, first thing is angina pectoris. What is angina pectoris? Angina is pain of crying myocardium. Is the described definition in history. So, crying myocardium because of oxygen deficiency. And it is typically presented as retrosternal chest pressure or burning or heaviness radiating occasionally to the neck, jaw or epigastria, shoulders or left arm. Chest discomfort or pain. You can see the typical placed by that person in the photo. That is a typical presentation of angina. The person will be holding his fist like this, and he will be feeling heaviness in the chest. It is a universal sign of ischemic chest pain, and the patient holds the clenched fist over the chest while describing the pain. Actually, this angina was described in 1772 by William Heberden. So he describes it as, you can see last three lines here. Constricting discomfort in the front of chest or in the neck, shoulders, jaw or arms, precipitated by physical exertion, relieved by rest or glycerol triangle within 5 minutes. These three are important points which you should know for life. Chest heaviness, I will repeat, chest heaviness or constricting discomfort in the front of chest or in the neck, shoulders, jaw or arms, and it precipitates on exertion. Andre ನಡೆದ್ರೆ ಓಡಾಡಿದ್ರೆ ಮೆಟ್ಲತ್ತಿದ್ರೆ ಜಾಸ್ತಿ ಆಗುತ್ತೆ ಅಂತ ಹೇಳ್ತಾರೆ, ಅಂಡ್ ಇಟ್ ಈಸ್ ರಿಲೀವ್ಡ್ ಬೈ ರೆಸ್ಟ್. ಒಂದು ಸ್ವಲ್ಪ ನಿಂತ್ಕೊಂಡ್ರೆ ಸರಿ ಹೋಗುತ್ತೆ ಅಂತ ಹೇಳ್ತಾರೆ. ಸೊ ರಿಲೀವ್ಡ್ ಬೈ ರೆಸ್ಟ್. These 3 points are very important to remember for life. Anyone who comes with this pain, you cannot neglect. So to discuss in detail about the chest pain, coronary causes of chest pain are typical angina. Just now as we discussed, angina that is precipitated by exercise, cold weather or emotional stress relieved by rest. This is typical angina. We cannot miss any patient with typical angina. Any patient complaining with this symptom, chest pain on exertion, relieved on rest. Sir, ಯಾವಾಗ ನೋವು ಬರುತ್ತೆ? ನಡೆದ್ರೆ ಎದೆ ಬರುತ್ತೆ, ನಿಂತ್ಕೊಂಡ್ರೆ ಸರಿ ಹೋಗುತ್ತೆ, ಮತ್ತೊಂದು ಸ್ವಲ್ಪ ನಡೆದ್ರೆ ಮತ್ತೆ ಎದೆ ಬರುತ್ತೆ. This pain is typical of angina. It indicates there is significant blockage in coronary blood vessels, supplying oxygen and nutrients to myocardial. So whenever we get a patient with chest pain, first thing we should ask whether it is anginal type of pain or not. If it is not anginal type, then we can evaluate in detail. If it is anginal type, straight away we have to think of cardiac. So unstable angina, definition of unstable angina is same typical angina, but is of more severe intensity, and it can last up to 20 minutes, of lower tolerance for exertion, and it will be of crescendo pattern. It means increasing intensity. Then coronary cause of other chest pain is acute MI. Acute MI will be same typical angina if it is persistent for more than 20 to 30 minutes, causing